first thing that the president raised was the fact that he'd inherited debt. And the question becomes, well, and he also said that his health care plan was going to get rid of debt and was going to save money and would work really well financially. And the question then becomes, well, if that's the case, how come Medicaid and Medicare seem to be costing so much? If the government can't run those without running a huge deficit, what makes you think we can go further? Well, that's one question, is how much it costs. A lot of discussion on that. Another question is a question of bureaucratic rationing. I think a lot of Americans that do have health insurance have been frustrated by the fact that insurance companies sometimes tell you you can or you can't get treatment, and we don't want people rationing health care that are in the insurance business. We want that to be a doctor-patient kind of question. And so one of the big concerns about when the government takes something over, the government will tell you what you can and can't get for a treatment. And so because there was concern on this issue, one of the ways to probe and to test a bill is when it's in committee for people to be able to make amendments to the bill. This particular amendment here was offered by Congressman Gingrey from Georgia, who is a medical doctor. And the thing that I like about it is it's a very straightforward and simple statement of policy. And it says this: nothing in this section, this is being added to the Democrats' health care bill, nothing in this section shall be construed to allow any federal employee or political appointee to dictate how a medical provider practices medicine. In other words, what this language is saying is the doctor-patient relationship is sacred. We want the doctor and the patient to make the medical decisions, and that's what this particular sentence was trying to enshrine into law in the middle of this bill. And so this amendment was offered in a way to kind of determine really where are we going with this health care debate. And this amendment was defeated on an almost straight party line vote. The Democrats, with the exception of only one Democrat, voted that this language should not be in the bill. The Republicans 100% said the doctor-patient relationship should be sacrosanct. So this is a place where, through an amendment in committee, we know what the plan for this bill is, and that is that there will be federally paid employees or bureaucrats telling you what kind of medical treatment that you can get. And this, of course, is what happens in Canada and England and all, so it's not a big surprise. But this amendment makes it very clear the difference in policy between the Democrat plan, which is that bureaucrats are going to determine what's a reasonable procedure for you to get, and it's not going to be based on the doctor and the patient. We don't like, as a Republican, I don't like insurance companies butting in there. Even more so, I don't like the federal